Hello and welcome to Tuesday Talk. My name is Akhil Khan. I'm the director of Project Open. Project Open is a federally funded HRSA grant from the Human Resources Service Administration aimed at combating the rural opioid epidemic. As we know, the opioid epidemic is taking lives every day across our country, and through COVID and the pandemic and stay-at-home orders, unfortunately, those numbers started to increase. Uh, there was no one way to tackle the opioid epidemic when we got our group together. And again, Project Open is in Northwest Illinois with 3 counties. It's a multifaceted approach, and it involves a lot of collaboration. And today we're really excited to have with us Danny Langloss and Darin DeHann. Danny is the city manager of Dixon, Illinois, which is the county seat in Lee County, which is Northwest Illinois, about 100 miles west of Chicago. And he's actually the founding member of the National Police Council for PARI. And PARI is the Police Assisted Addiction and Recovery Initiative. And we'll have Danny talk about that a little bit. And today with us, we also have Darin DeHann, who was a former police chief, as was Danny. So we're excited to get that perspective. Darin was a former police chief of the Oregon City, which is about 15 minutes northeast of Dixon. And Darin is now the city administrator of Oregon, Illinois. And so we're really excited to have these two experts here join us. They're going to bring their law enforcement perspective from their time as police chiefs and as detectives and working the streets, and now to city official standpoint. So, Darin, Danny, welcome to the show. Thanks for joining us.
Thanks, Akhil.
Darin, if you don't mind, I just wanted to pass it off to you real quick. Just a brief introduction, a little bit of background about yourself, so the listeners kind of understand a little bit more about where you come from, and then why the opioid epidemic and the topic of substance use disorder and addiction is important to you.
Absolutely. I started with the Oregon Police Department in '96, kind of worked through the ranks in part of that tenure was working as a detective, lieutenant detective. So I was involved with a lot of the area task force. And then in 2005, I transitioned to the chief of police position, held that up until 2020. And again, during that time, continued to work with some of the area task force. And as well as working on the issues within our city. So had some experience there in 2020. Again, I converted over to the city administrator position. So it's kind of a different bird's eye view of the city. A lot of times as the chief, you're working kind of on minute issues within the criminal justice system. And the opportunity from a city administrator position and a manager position is an overall view of the city and the impact of everything that happens. So I do think it's kind of given me some good perspectives from both sides as well.
Thanks for that, Darin. Danny, same question.
Yeah, my name is Danny Langloss. I'm the city manager for the city of Dixon. I too started in policing in 1996. All I ever wanted to do since I was a young boy was be a police officer. Went to investigations, spent 7 or 8 years there, and end up in a similar role that Darin had over investigations. And then in 2008 became the police chief of Dixon. Served in that role for right around 10 years and then transitioned into the city manager role. So in addition to being with the city, as Akhil mentioned, I am on the National Police Council. I helped found that with PARI. PARI is based out of Massachusetts, but it's now an organization that supports more than 400 law enforcement agencies and communities in more than 25 states. And so it's just an incredible organization. Couldn't be more excited to be here today.
Yeah, we're very excited for you both to be over here. So you guys have two very unique perspectives, started in law enforcement and kind of with that lens, and then have the city manager lens. Can you just at a high level talk about your experiences with substance use disorder and addiction from both lenses? And Darin, would you mind starting?
Yeah, and this is a really great conversation to have today. As recently as over the weekend, I had a kind of a friend of mine that reached out and asked for some advice on their child in crisis. And he's currently using methamphetamines, and they were trying to figure out how they handle some issues and things like that. So this really has impact on our communities. So as far as police chief, it's one of those things where you're always responding to issues in the community. You've got individuals as far as landlords and property owners around areas that we see substance abuse. And it's kind of a ripple effect often, especially in a small community. It's often, a highlight in a certain area, and certainly the local communication, like everybody kind of knows what's going on. So you have a lot of pressure to try and handle situations. So historically, law enforcement's response always was, let's target this house, let's target this area, let's start following vehicles, let's start doing a bunch of activity in the area. And so you're trying to work up a case, which takes months and months. And Danny can attest to this as well. And you may or may not hit your mark and be able to get criminal arrests in the situation and try to quote unquote resolve the issue in the neighborhood. And so that was always the mindset in law enforcement for most of my career, is just going after the quote unquote bad guys and bad girls and trying to make a positive effect, which again, we felt like we were doing that. We were, limiting calls for service in a home, or when they were dealing, we were getting these people to stop coming into an area. And so neighbors felt like we had made this great impact, but in fact, we weren't fixing the issues. So I think as we've gone in through our career and we continue to learn from programs like Danny has put together in Dixon, that there's a different and a better way to respond to these issues.
Yeah, I'll build off some of what Darin said, because a lot of what his experiences were our experiences, and there's an important role in enforcement. We've got a 4-pillar approach that I think we'll talk about in a little bit, but enforcement is key, because a lot of times where there's drugs, there's gangs, and there's guns. And so I think there's a different strategy in how we address drug dealers, organized gangs, violent criminals versus people that suffer from substance use disorder. We know that 20 million people in our country, a minimum of that, suffer from substance use disorder. And of those, only 10% get treatment. Of the 2.2 million people in jails and prisons, half of those people have substance use disorder. Of those people, only 11% get treatment. And so when we look at the revolving door of the criminal justice system, basically once you get in, you don't get out. Should we be surprised when somebody goes to jail or goes to prison and gets out and reverts back to substance use disorder, reverts back to drugs, when we haven't offered them any treatment at all? And I think that answer is obvious. The answer is no. What we got to realize is substance use disorder is a chronic relapsing disease. It's not a character defect. It's not a moral flaw. And so we've got to look at it, and we've got to address it from that situation. And when we look at this problem, addiction and mental illness are two of the most critical issues facing every community across the entire country. Mm-hmm. No community is too rich, no community is too small. It doesn't matter if you're black, white, Asian, Hispanic, male, female, rich, poor. This disease doesn't discriminate. And I think one of the things that helped as we began to reshape perception on people with substance use disorder was the opioid epidemic. I don't want to go too far into that to let you lead the conversation, Akil, but one of the big differences with this epidemic, when you look at the national heroin epidemic, is it's founded in a lot of times legitimate opioid pain medications. So 4 out of 5 people that are addicted to heroin started on opioid pain medications. And of those, 33% had a legitimate prescription. Those are crazy numbers. Mm-hmm. So this was a much different thing that during the time as this was evolving, we didn't even realize the negative impacts of these opioids. The doctors didn't. Big pharma is who realized and recognized it, but nobody else did. So people unsuspectively were becoming addicted to these opioids. And somebody might say, hey, okay, you find out you're addicted, quit. The withdrawals from opioids are so significant. The bone aches, the uncontrollable vomiting. I've had people explain it to me like somebody's ripping your spine out of your back. It's just not that easy. And as we began to get out and explain this to law enforcement, understand the fundamentals of that, we began to see a shift as we said, hey, we can't arrest our way out of this. It's treatment or death. We'll talk about those death numbers here in a minute. But we've got to change. We've got to change our approach. And the last thing I'll finish with before I kick it over to you is if law enforcement and the criminal justice system were a for-profit business, we would have gone bankrupt decades ago because what we're doing doesn't work. And only because we're government funded have we allowed to continue and continue and continue on this very failed war on drugs. We've really got to reshape the war on drugs. It's got to be a community-based approach. And that's what I'm so passionate about, because I've seen the difference in the impact from these programs, seen guys become fathers again, kids get their mom back and those types of things, people be safe. So I'll turn it back to you to kind of lead that conversation.
No, Danny, you nailed on some incredibly important stats. And when you talk about it, how the opioid epidemic started to take hold, I mean, we got our initial grant, Project Open, was in 2018. And it was a $200,000 planning grant, and we partnered with Lee and Ogle County. And in that, we did a key informant survey. So we found people who were actively using or were recent users, and we asked them, how did your addiction start? And half of them in that small sample size says it started in the doctor's office. Started with a large supply of hydrocodone or some pain medication after a dental procedure or after surgery. And they thought, okay, doc said I got to take all 30. I got to take all 30. And by the end of the 30, your brain is already slightly adjusted, and then you kind of have that craving or that need. And so I can totally appreciate the stat you mentioned about it not being some sort of what we thought was maybe an underground black market drug trade. Truthfully, it started in a very pure and a good intentioned way, and it just unfortunately we didn't have the knowledge or the research. And just so listeners know, one of the big projects Project Open on is working with prescribers, because opioids do play a role in pain management. But there was a time in there when pain was made the fifth vital sign, and that pain is very subjective, right? So patients were saying, oh, it's through the roof, and doctors wanted to satisfy it because hospitals were graded on how they managed pain at one point. So opioid prescriptions just flew through the roof, and now we're kind of seeing that effect. And part of Project Open's effort is to kind of curtail the average day supply. And so that was one big thing that I wanted to bring up. And then, Danny, you mentioned something about it doesn't discriminate rich versus poor, but some of the data does suggest that people in poverty, people with lower socioeconomic status, do have a higher propensity to become addicted or use. What have you guys seen in your experience with that?
Yeah, I think that when you extrapolate for crime, people who commit crime, people who are in the criminal justice system, the controlling factor, and this is from my research and my thesis several years ago, actually isn't race, although the obvious thing is race and ethnicity, right? It's poverty. The controlling factor is poverty. So when you are in poverty in those lower socioeconomic classes, you are much more likely to engage in criminal activity. It doesn't mean you're a criminal, right? You're more likely to have mental health disorders. You're more likely to have substance use disorders, because some of the stuff, when you look at substance use disorder, has to do with the coping, has to do with the stress, has to do with the strain. We can't even begin to imagine what it's like. My dad grew up in the projects on the south side of Peoria. His mom died when he was 15. His dad was an alcoholic. In order to play baseball, his brother had to go steal a glove for him, right? And so I didn't experience that personally, but I did to my dad. And the challenges and struggles he had to adapt to and overcome, and the way that impacted him, and then going into the service at a very young age and being in Vietnam, that's a much different experience. And I think the three of us have had. And so I think some of those things are there. But here's the thing. You could put 10 people in a room, and they could all end up over a month period of time consuming the same amount of opioids. But we're all different. Some of us are more susceptible to our personalities, our DNA, the neurochemicals in our brain to become addicted. And so I think that's one thing we want to be sure to mention, as well. It's not you take 15 of these over 5 days and you're going to be addicted. Some people will be, some people won't. But it's very individual. It's like, I can eat cheeseburgers my whole life, and you can eat cheeseburgers your whole life. I can be 20 pounds overweight and have heart disease, and you can be just fine, right? Like, everybody's impacted differently.
And you said something about there's genetic predispositions. What some research has found in the recent RecoverCon event, Johan Hari talked about it, is that it's the absence of connection, right? The absence of social connection. So oftentimes addiction starts with loneliness, and we can put that on the back burner for now, bring it up a little bit later. But I wanted to get Darin, the national opioid epidemic. You were a police chief at the time that this really started to gain national attention. How has your view changed on the opioid epidemic from the time you were a police chief to now, here in 2020 and 21, you become a city administrator? How has your viewpoint changed, and how is it the same?
Yeah, absolutely. And I think this is one of those things that these discussions are so important, so that law enforcement gets exposed as often as they can to some different perspectives. And I'll say, here in Oregon, we started experiencing individuals that were reporting burglaries, constantly reporting burglaries. And what they were claiming is individuals were coming in and taking their prescription meds. And I'd actually reached out to the area chiefs associations and said, is anybody else seeing these kind of anomalies with these increased burglaries? It got to the point where we had to kind of create a system and work with area doctors so that they would actually contact us and not reissue a new prescription, because obviously what was happening is overconsumption of those prescriptions. They were then reporting them as burglaries. They were trying to take a copy of the police report to their doctor and get it reissued. And I think what that did as well is a lot of these individuals that are, they don't have a car, and they were getting individuals. I saw this through my career where they would get an individual to help them go back, get another prescription. And they, just like you said, is they're not socially connected. But if you can get somebody else in your addiction cycle, that's somebody to share that with. And then you go through those same experiences, and they're your ride, and they're helping you sell some property to get more money. And it's just this cycle. And we saw this effect where we felt like we're a small community. We kind of have this, this isn't going to happen here perspective. And then we saw it grow. And we saw these individuals who never hung around certain individuals, draw them in certain ways. And then the addiction cycle started with them, and it grew and it grew. And it was so influential over individuals that they were around that, again, you absolutely saw it explode. And then we were in it, and we're like, what are we doing? We started to see these deaths and these overdoses. Started with the Narcan training and bringing individuals back. We had one day where we actually we used Narcan on 2 sons and a mother, all in the same day within a 4-hour period. And again, once you start to see those anomalies, you kind of woke up a little bit, but we were already behind the curve. So certainly, in my time that I've spent with Project Open and being involved in more a broader range of discussion, it's really opened my mind to looking at this issue in a different perspective, and sitting next to somebody that's a person in recovery and listening to the challenges that they've had and the things that they face in society to try and overcome this. And that is the most important thing, again, from my perspective, is I'm in a position to hopefully work on programs and look at things holistically from the city perspective, not only economic development, working with our churches and whatever we can do to try and get support for these individuals and get them out of that cycle and break that chain of, socialization amongst themselves, and it grows. So, trying to help all these individuals and to bring them and reconnect back to society in a positive way, I think is the most important thing.
And so earlier in the conversation was brought up that, what do we expect when we incarcerate someone, don't get them treatment, get back on the street, they use again, and it's that cycle that keeps on happening. And Danny, I want to talk about the Safe Passage program, which was a very revolutionary way to try to break that cycle. Can you talk a little bit about Safe Passage?
Yeah, thank you, Akil. So in March of 2015, we had 3 heroin overdose deaths in 10 days. Just shocked the community. There was a call to action like we'd really never seen before, really spearheaded by Kathy Ferguson, the health department administrator for the Lee County Health Department, and then a high-ranking official within KSB Hospital. And so for really the first time, you had the health department, the hospital, the police chief, the sheriff, the substance use community, faith-based schools, I don't know if I said state's attorney or not, a judge, all sitting around the table and talking about this and saying, what is it that we can do? And there was a lot of conversation about awareness and community forums. And so we did that, which was big. But as we were sitting and talking, Allison White, who's part of a group called Safe Harbor, looked to the sheriff and I and said, have you heard what the police chief in Gloucester's doing? And we said, no, what's he doing? And she said, he's going to let people come to the department, turn in their drugs, turn in their drug paraphernalia, not arrest them and put them straight to treatment. Would you guys be willing to do that? And we looked at each other right away and said, yeah, of course we would. But the thing is, for about 9 years, I specialized in drug investigations, worked a ton of cases. And many times the people that were helping us get the drug dealers, the informants, people with substance use disorder, we tried to get them treatment. We tried to use our badge to get them through the door. You couldn't get it done. In Dixon, Illinois, the closest detox or inpatient treatment facility at the time was an hour away, and most were 2.5 away. And so you would call and you would get on waiting lists, and these things would be 2, 3, 4 weeks. And so Allison ended up setting a call up with us with the Gloucester police chief. And he talked about things like, we can't arrest our way out of this problem. It's treatment or death. He was going to take a stand against the treatment system. Now in Gloucester, they had some really good treatment options, but that was only if you had something, right? That's only if you had insurance or if you had cash and money. And so he was going to take a stand because people were refusing to treat people who didn't, because, Medicaid, Medicare reimburse at different rates. And so we took his model, and we weren't going to be quite as aggressive as that. But what we did was, we met with Rosecrans out of Rockford. I want to give them all the props in the world to learn about the treatment system, to learn about who were reputable treatment centers within our region. Then we reached out and got meetings with all the executive directors. And by the time we left the meetings, we had partnerships with 10 or 11 different treatment centers. And we were able to create the Safe Passage Initiative and become the second program in the country to do so. And since then, we put nearly 500 people directly to treatment. When I say directly, imagine this. Somebody comes into the police department or calls in now, or the ER might call us and say, hey, I want to go to treatment. I need help. Generally within 45 minutes to an hour, we know where they're going. And within a couple hours, we can have them on their way to treatment. And so that's the Safe Passage Initiative. And there's been some evolutions to it with recovery coaches, coordination of care, and some lessons that we learned from that. There's been an evolution in our area from the recovery homes, Project Open, many community forums, Narcan implementation, drug take back, all those types of things. But whatever questions you have about Safe Passage, go ahead on that. But that's the overview of the program.
So how did that shift from arrest to police defection? How did that impact local government? So you did that as a police chief. Now you're sitting here as a city administrator, and you look back on that program. What impact did it have on local government, you think?
Well, I think it had an impact on the entire community. It's one of the things that we're most proud of and what we've done here, because it completely changed and began to eliminate and reduce, not eliminate, but reduce the stigma as related to substance use disorder. There are so many people that, in the cynicism of policing years ago, in my younger days, I'm sure Jaron, had this, said, this person is never going to turn their life around. There's nothing we can do to help this person. And we've seen countless people that was said about that have turned their lives around, that have jobs, have stable homes, have families. One of the most rewarding things I think ever happened was I got a Facebook message 2 years after we put a guy into treatment, got him through treatment, coordinated his care. And his wife reached out to me and said, we just can't thank you and your team enough, because for the first time in 5 years, my son had his dad at a t-ball game, and his dad's out playing catch with them. And that's important, right? Because I think there's generations and cycles and things like this that happen. And so that's the true impact. We saw a reduction in our numbers in the jail. We saw a reduction in our numbers in crime. We didn't have that scientifically researched because we weren't going to pay thousands of dollars to do it. And we've seen so many people that have maintained that. And then what's really awesome is when somebody has got to sobriety and long-term sobriety, right? So more than a year, 2 years, 3 years, 4 years, and then they come back and then they are helping people, because those are the rock stars within these community partnerships that you can't forget. They change everything, and that's the recovery community. And you see what Gerald Lott's doing now with his team, Sauk Valley Voices of Recovery. You see what Allison White has done, and she ended up becoming our full-time Safe Passage coordinator, serving Lee and Whiteside County, and we served Ogle County some as well. And so there's so much power there, because we can read books and we can talk to people and all those things, but when you sit across from somebody who has that experience, who's been through it, that kind of takes it to a whole new level.
Darin, anything to add to that?
No, I think from being his northern neighbor, we certainly saw the impact very early on. And it put us in a position where I remember sitting in my office, we're doing interviews on several suspects on some burglaries, and I'm talking with one of the female suspects, and I'm trying to offer her a different route. I'm talking about how I knew it was related to, her substance abuse disorder. And she just kept, she was exasperated, saying, you never help. You guys always talk because you want information, but you never help. But there certainly were avenues at that point where we could hook her up and get her help and get her out of the system and hopefully change her life. But she was just exasperated at the point, and she was deep into this substance abuse and just didn't feel like there was an out. So again, just being Danny's northern neighbor, we saw impact very early on. It was a fantastic program that's done some great work.
Yeah, no, I came to the community in 2018, so about 3 years after Safe Passage was implemented. But it was very clear to see the passion from folks like Allison White, Joe Lott. Advice that we'd give to other communities now is, as Danny mentioned, the voice of someone with lived experience, someone in the recovery community needs to be involved in these processes. We sat around a table with some of the smartest people in our area, designing and trying to implement new programs. And it'd be the person with lived experience who'd be like, that sounds really great and that would work in a perfect world, but here's how this, you need to adjust it, or here's why it won't work because of these reasons. And that perspective, totally, I mean, we just crumple the paper, toss it out, and start it again. And so that would be kind of a word of advice to other local governments considering a police deflection program. And I know, Danny, PARI would help with this, or who could help organizations get a police deflection program started?
Yeah, so PARI absolutely could. So through PARI, we have actually helped more than 150 communities across the United States create programs just like Safe Passage. One of them is the biggest program in the country called Hope Not Handcuffs. It's in Macomb County, Michigan, serves about 750,000 residents. And so, we have a team that consists of myself, the police chief, Steve Howell, Jeff Reagan is one of our detectives. And so through Illinois, into Iowa, into Indiana, we've gone into, but, me with PARI, we've been, really all across the country. And so they're there specifically to help do this, to create policies and things, and we'll come out. So that's important when you're going to engage law enforcement, because, it's hard to change perspectives and it's hard to change views. And one of the things when we went to Macomb County, Michigan, there were 25 police chiefs and a sheriff. The chief judge and somebody it'd be the equivalent of Sauk Valley Voice of Recovery had reached out. And so I flew into Macomb County, Michigan. One of our partners from PARI flew into Macomb County, Michigan. Our job was to convey the importance, the why law enforcement should step on board and do this. And they had about half for, and the other half were either against or just weren't sure and ready to commit. And so the power of this and getting law enforcement on board and your state's attorneys on board and your judges on board is that a lot of these things will run with and through them as that goes on. And so we did that. And after we presented for about an hour and a half, John Rosenthal took the first part and I took the second part and talked to him as a police chief and what we've seen and what our goals are. The mission of every police department is to create a safer community. Are we tired of banging our head off the wall? And when we finished up, they said, okay, whoever's on board, whoever wants to join can get in the picture. But if you're not sure, we only want people that are for sure. And every single chief and the sheriff got into that picture, and that program just took off. And so just understanding who the right people are to come in and to bring in as we do this is essential. And these programs, I don't know that there's ever been a greater impact I've been part of to help save lives, change lives, restore families, create safer communities.
Thanks for that, Danny. And so I just again want to emphasize that resource is out there. So if any local government is listening to this and finds this program interesting, I know Danny would offer his assistance, and then PARI. Absolutely. I'll put the website up one more time because it blended really well with your blue shirt there, Darin, for a moment in there. Perfect blue shirt over there.
Oh, there we go. Okay.
You talked about safer communities, and Darin, in an earlier communication before this thing, we had talked about crime impact, drug-related crime on, the sense of safe that community members might have, and then kind of a reaction to something, an event happening, or people might maybe, I think you used the word building walls and fortresses or something like that. Can you kind of dive into that a little bit from your lens?
Yeah. Law enforcement's constantly collecting statistics. We're looking at crime stats all the time. And oftentimes I think it's just, we're checking a box. The state wants our crime statistics. The feds want our crime statistics. And it wasn't until I started getting involved in economic development that I really saw the impact of those crime statistics. You always knew as a police chief, you want to repress crime. You want to show a safe community and make sure everybody feels comfortable living here. But it was, again, when I started working on economic development and seeing that a potential multi-million-dollar developer is looking at your crime statistics to decide whether or not to do some development in your community, that it really hit me on another level. That individuals are looking at this as far as moving here as a quality of life. And really what happens is when you start to increase the number of calls in a certain neighborhood, I think individuals do go into this fear mode, and they lose their sense of safe. And so no matter how many times you're down there trying to arrest them, individuals, it really created this fear factor that people thought this major criminal activity is going on. And we've always had issues with individuals in our community not wanting to get involved as far as reporting crime or criminal activity, because they always felt that there was going to be some kind of repercussion from the criminal element. So again, it's so important to take a look at these things because it has such a broad effect on development and individuals coming to our community. We're all very well aware of our current census and how important that was. We had seen a loss of population in our rural communities, and we all worked very hard to try and increase that population, which relates to, sales tax income and state income, which allows us to do other programs and fix streets and do all the things that we need to have a quality community. So it's so important, again, to have an overall view of the impact of this stuff for your community so that you can get people to come here and want that quality of life.
Danny, anything to tag on to that? Darin has got us to the meat and potatoes of why we're here today, the economics of addiction, right? The impact that it has. You talked about the sense of safe. You talked about crime statistics. I can't help but think that developer who might see that number, they'd be like, I don't want to build there anymore. The impact that has on jobs, then the impact that it has on retaining residents, which then has the impact on state income dollars to build roads, and the good roads attract. I mean, that cycle, gosh, I don't envy your jobs at all. Danny, anything to tag on to this discussion right there?
I mean, I've felt this for a while, and I know that I'm a little biased, but there's no greater investment in your community than public safety. If people don't feel safe, they're not going to want to be there. And I think, Darin, hit it out of the park with his answer to this, and developers are absolutely looking at that. And I think, I think there's two sides of the story you can tell. When we tell a story and a lot of the economic work we're doing, it's about crime statistics as they look at those, but it's about community partnerships and the way we serve the community. It's really about the fact that we care, that we're responsive. And you don't see communities putting together partnerships like Project Open. And in the early days, like, what PRISM was. And it says something about the forward thinking and the leadership in the community. And the other thing you can't miss is now more than ever, especially in the larger companies, their employees are requiring them to be purpose-driven, to be involved, especially in social justice type issues. And so it's just another layer of how we can tell our story and what it is that we're doing. But I think it starts with caring. It starts with realizing, behind every death, there's a family, right? I get the fact that there's an economic impact. I get the fact we're going to look at these things crime statistic wise. Somebody said, well, this is awful weak on crime. Well, no, what was weak on crime was the approach we used to take, right? It was dumb on crime. This isn't weak on crime. It's smart on crime, and it works. And so to Darin's point, when you implement programs like these, full community involvement. I mean, look, KSB Hospital, you have detox now. You never had detox. I think it just went full service. We've got MAT in our area now, right? Like all these different evolutions, and these things are important to show the world that we have our stuff together and why you should come and make an investment here.
So it's the community-based approaches that then ideally lead to lower crime, which then lead to more development, which lead to more jobs. So it sounds like this first domino in this whole process is community-based approaches. So can both of you dive into some of the things you guys see as far as, we'll start with what were some community-based approaches that we thought were going to be successful that didn't end up being, so there's lessons learned there, and then we'll move to what have been successful. So what did we do in the past that didn't work from a community-based approach? Darin and Danny, jump in whenever.
Well, I think historically for myself is there was such a stigma. So when we tried to do some things publicly, people just shied away from those things. So one, they wanted to kind of keep their head buried in the sand that can't possibly be happening here. And two, I think that stigma kept them from coming together and starting to organize and to kind of work on things. So I think that's changing over time, again, with Project Open and really delving into using the right language to describe people that are in substance use disorder, taking a look at mental health and destigmatizing that. I think those are all the big steps that we have to take where we failed in the past. But I think that was a society issue as a whole, that we couldn't get past those stigmas. So I think the first step is, again, working on those stigmas within your community, showing the effect that individuals can come out of, can go into recovery, and they see success. They can rebuild families, they can rebuild positive relationships. And again, starting at that basic level of stigma is very important.
Danny, anything to tag on to that?
When you look at lessons learned and failures, I think early on the fact that, that we thought the criminal justice system could handle this problem that just has gotten so much bigger you could ever imagine, was a failure. Through safe passage early on, coordination of care was a failure. We'd get all this work and we'd get somebody to detox, and then we thought we were going to be communicated with and they're ready to transition, or they were going to transition. And next thing you know, they were back and they were relapsing, which is really dangerous when you come out of detox. And so we had coordination of care, but then on top of that, the follow-up and providing different things. So I don't think we had any huge failures necessarily. But there were always ways to improve and always ways to more wrap ourselves around people and to help them, which is so essential as we move forward.
Danny, you talk about the handoffs and, you send someone to treatment when they come back. One of the things that happened during the planning phase of Project Open was the sequential intercept model. And a lot of hats off and a lot of credit goes to Natalie Andrews, who led a lot of these early efforts. And that model looked at, what are the entry points that someone can come into the system, right? From the ED, the police department, to any social service agency. And then how equipped are those agencies to handle that individual? And I think that helped us learn that, hey, look, a lot of people don't know about the varying resources. So even in a small rural community where a lot of people know everybody, the agencies weren't talking together. And that's what I think is one of the biggest pros of Project Open, is now agencies are starting to talk together a lot more and be more aware of the resources. And from there, we've been able to bring, the groups have been, all of our provider and treatment group was able to bring MAT. KSB's had a detox program in varying forms. It's a lot more formalized now, and we're coordinating with CGH and working together a lot more. And so I think that was probably what I see as one of the biggest wins, is the fact that no one was trying to attack this in isolation. So it wasn't just criminal justice, you solve it, or treatment hospitals, you solve it. It was no, anyone can come at any point, of their, it's a spectrum. It's not a binary thing. They can be at any point of their recovery or addiction. How do we make sure that we equip them? And it was becoming aware of everybody else's strengths and leveraging their weaknesses.
Yeah, it was, Akil. And I think you nailed it. You got to have one of the big things, whether you're going to run a program like this, or whether you look at the success that we're having right now coming out of COVID with our economic development team. It's all about teamwork and partnerships. And we can't surround ourselves with people who are the same. We've got to surround ourselves with people that are different backgrounds, different struggles, different educations, different life experiences, different work experiences, different sectors, because it's going to take all those things. And early on, we were doing a lot of incredible work with Safe Passage, but not until KSB, fully understood the impact, and, Dave Schreiner became 100% committed, your administration did, not until the court system became fully committed, not until, Mississippi was always fully committed. The police became fully committed, not until we had these partnerships even outside of our community were we able to take it to the level it is now, because we didn't have detox. We didn't have recovery homes. We couldn't get people to treatment. None of those things. And now, like you said, it's that whole spectrum. And now, a lot of the work you're working on with some key partners, which I really applaud, is, the job placement and those kinds of things, which I know you're going to talk about in a little bit. So it's really about understanding 360 what people need who are in the recovery phase. Again, why it's so important to engage people who are in recovery, and then being able to take all these people from these different areas and align them around a common purpose. It's really a powerful thing. The synergies that have been created are just incredible. And I applaud the work you're doing to run Project Open and to keep all this moving in the right direction, because I know it's a lot of work.
There's no way that I could take all the credit for. There's a lot of people. I mean, Darin, Danny, you both are big parts of the effort. The recovery community, treatment community, behavioral health. There's just so many players involved, and I'm happy to be a part of it. I wanted to share a stat that I looked up a little while ago that talked about of every dollar that federal and state government spend on substance use and addiction, about 95.6 cents were to pay for the wreckage, 1.9 cents went to prevention and treatment, zero point 0.4 cents went to research, 1.4 cents went to taxation and regulation. So our overwhelming majority was in the incident itself. And you had mentioned earlier, if police departments run as for-profit entities, they go bankrupt, right?
Oh yeah.
Now I think we're starting to see the shift toward. Actually, I know because of Project Open. I mean, the federal government literally said we need to put money towards this. And Project Open started as a $200,000 planning grant and is now a $1 million 3-year implementation grant, where we're implementing a number of innovative solutions. And again, we won't talk about it here, but I encourage everyone to visit theprojectopen.com, the Facebook page, or listen to one of the earlier Tuesday talks, the second one that talks a little bit about it. But there's now, I feel like, a lot more dollars being put towards prevention and treatment. And now the next frontier is recovery, because there's not a lot of money. And what I've learned through my research, is that peer support is as important, if not more important, in someone's treatment recovery journey than treatment itself. And so I just, I'm going to throw that out there to see what you guys' initial impressions or thoughts or experiences are with those kind of stats. And thoughts.
Yeah. Getting through a 5-day detox and a 29-day, program, of treatment, that's the beginning. And if that's all we're going to do for somebody, our success rates are going to be super low, right? They're going to be 10%, 15%. But when you talk about the investment and and recovery, Akil, and really the peer support and wrapping our arms around people and making sure they're getting where they need to go and making sure that treatment is coordinated, it changes everything. And I mean, we're seeing numbers over 50% that have come through our program. Now, the great thing with Project Open is, as police officers, we're not researchers. We know that there's an incredible impact. We're working with the people. We're working with the families. We're seeing the lives turned around. But if we're going to continue to direct money here, we're going to continue to direct it towards the recovery side. The work that you and your team are doing by compiling all that data is going to be essential, because, money is going to follow the data, and the stories are going to be important as we sit in front of legislatures. And that's why, the grants were created for programs like ours. And we've received an $80,000 a year grant thereabouts for the last 5 or 6 years. The stories mattered when we passed the first police deflection legislation in the country that authorizes, legitimizes police deflection. So there's no more arguments like there were in some suburb areas between a state's attorney saying you can do this or you can't. But you got to have the stories, you got to have the data. And so I really appreciate the work that's happening there around the data.
Yeah, I think I think this is a telling tale. Years ago, the amount of money that was coming down from the feds and the state to go towards enforcement programs, equipment. I mean, as a small community, I got like a $40,000 grant for a thermal image camera for drug interdiction. Flew us out to California for the training on it, all expenses paid. And then you're starting to see that dry up. And of course, small departments use that to fund things that they didn't have, whether it was a squad car, camera systems, or whatever it is. We all wanted everything that we could get to try and do other things. It didn't always have to relate to drug enforcement, but we were using these equipment grants to supplement our budget. So a ton of that money was coming down, and over a period of time, you certainly see that kind of shifting in the right direction. So the programs like Project Open and the other things that are being funded. And I think that's very important. We've had a lot of talk here in Oregon looking at a grant writer, even whether it's part-time. It's a skill set that you need, and trying to go out and find these programs that help our communities. It was easy back, 15 years ago to write a grant to get a piece of expensive equipment to do interdiction and those types of things. Now it's a certain skill set, like Danny was talking about, bringing those numbers together and letting them see the impact on our communities in writing these grants to enhance our help for individuals in recovery and in use as well. So I think that's a positive shift that we're seeing through the federal grants. Absolutely.
No, and what I would add to that is the grants are great because the grants get people together. It gets the conversation started and injects funds into something that otherwise wouldn't have started. Right? Project Open lives and dies by that initial fund that we have, but sustainability is the key part after that, right? You can't just take the money and put it into offsetting costs of certain things and just keep draining the money. You have to look at how do you start up a program, but then find ways to make it sustainable. And right now, as we enter the third year of our grant, that's the big focus: is how do we spend the money to where when it dries up, as you mentioned, the thing doesn't stop, that the machine is already, moving, and that. But again, I gotta credit the grant. I gotta credit the federal government. Our grant comes from HRSA. Their specific program is the RCORP, Rural Communities Opioid Response Program, and they've got re-up. So there's going to be another cycle of it, and next year. So 2022 in September, they will launch the next cycle of a 3-year funding, $1 million. So if anyone's out there listening and wants to look into this fund, I encourage you to reach out. Again, Project Open, contact us. It'll come directly to me. We're happy to share our template, our application, and the data is key. Every 6 months, we submit data to the federal government on how many people were screened for substance use, how many of them came back with positive depression, positive anxiety, what were the types of drugs, where's the money going for, the community intervention programs. I mean, they're just, everything has to be tracked, because I've seen it far too often where you anecdotally think it's this way and then you make decisions based off those stories, and then the data says something different. And so data and numbers are king. And that's why it's Project Open's cool, because we have law enforcement on the group who work on the streets and understand the individuals. And then we have hospitals who've got the data on admissions and diagnosis codes. And you have the social services who've got the referral rates. And it's all being put together now to ideally apply for more funding and then continue sustainability. So, if you guys if there's nothing to add on over here, I was going to pivot the discussion into some interesting topics I wanted to bring up.
So the only thing I wanted to add, Akil, is that, from police deflection, the way this was growing and these community-based approaches, we were seeing a lot of great things. But, and unfortunately, due to COVID and due to the shutdown of a lot of these treatment centers, mental health facilities, 2020 was a bad year. So in 2019, we lost 70,000 people to drug overdose, 49,000 of them from opioid drug overdose. Move forward into 2020 with all these treatment centers shutting down. This is going to show you the importance of treatment. The number is up. Remember, 70,000 people died in 2019. Over 93,000 people died in 2020. And for opioids, it was 49,000 in 2019, and it's 68,000 people died from opioid overdose death. When you take those drug overdose numbers and realize on the opioid side, for every one death, the statistics show that 9 people were saved by Narcan. And you take those numbers, I mean, those are some really, really big numbers. Those numbers head up to over 800,000 people overdosing from opioids. And so this is a major issue. And so we can't sit back on some of what the successes have been. There's a greater urgency now than there's ever been to address this issue and to create these community-based approaches.
Yeah, I mean, you nailed it. We Project Open was almost an unstoppable force. COVID hit, and COVID was one of the few things I think could stop it. We dialed off the gas a little bit. I worked for KSB Hospital. We had a lot of programs and things that we had to work at KSB, and so the grant unfortunately took a back seat. And what we saw was that it should have been the opposite. The grant should have become more and more important, because we saw it through isolation, through absence of connection, through loss of job, and multitude of other reasons that we could get into. Drug use, misuse, and fatal and non-fatal overdoses went through the roof. So the work that's being done right now in communities across the country is very, very important. And I'm happy that we're back on track and catching up on where we wanted it to be by this time.
Well, and on top of the substance use disorder and drugs and drug overdose, the mental health dual diagnosis, right? Like 80% of people who have substance use disorder have a dual diagnosis mental health disorder. So we saw sharp increases of depression, anxiety. I mean, all of us have felt the impacts of COVID in one way or another. So I just want to point that out from a brain health side as well.
I want to bring up a pretty revolutionary topic. It's been discussed before. It was done in Portugal. They did a study and it was a multi-year study where they got the best researchers and doctors put together. And the story is told famously by Johan Hari, who spoke at RecoverCon more recently, a recovery celebration event, an advocacy event in September. Ultimately, the research came back, and the researchers and scientists said that, look, you're going to save this, you're going to stop this issue from happening if you legalize all drugs. And what they noticed is when they legalized all drugs, from methamphetamine, cocaine, heroin, everything in between, and they kind of regulated it. You would have to go to the pharmacy to get it. It stopped a lot of their issues. What do you guys think about that concept? And if you like it, or what what's preventing the U.S. from doing something like that? And this might be your law enforcement side kind of coming through a little bit too.
Yeah, I think a part of it is, again, there's government agencies that live on the enforcement of drugs and interdiction and all of those things. That's their budget. So you have to have some shift in philosophy in those agencies as well.
Mm-hmm.
I think what we need to take a look at as a country is that black market hasn't changed, and so people have been getting their drugs illegally forever. It doesn't stop the flow. All of the efforts that we put in, all of the money that we've thrown at it, and it hasn't stopped those efforts. So I watched that presentation in its perspective. I've watched it over the years, and Portugal certainly is kind of a living study to take a look at how things have changed and how that's impacted. But I think, again, it starts just with basic discussion on, looking at that and educating people and people in positions to make decisions to understand there may be a different way of looking at things. So it's difficult, and I still struggle on some things, switching from my law enforcement side of thought process, and because it's ingrained in us that the enforcement was helping save our communities, and so we still have a job to kind of change the thought pattern of the new officers that are coming in, and I think they'll be open to that. I think our newer generations are going to come into law enforcement obviously with a much different perspective, and you'll see buy-in for these concepts and things like that. So it's a broad stroke because America is not Portugal. We have to see if those things can happen. But I think, again, the important piece there is, can we shift money to help people through recovery and in treatment and reintegrating them into society and creating jobs and giving them something to live for besides that high and that feeling. And I think that's where we have to have a complete nationwide shift in thought process. And so where do we get there? Again, it's these discussions like this that help open your minds and take a look at other ways of doing things, and we'll see kind of where things go from there. But certainly, I've been watching those statistics and taking a look at over the last several years.
I think one of the things that jumped out, and I don't remember the exact numbers, so please don't quote me, but it was something about the legalization of marijuana took so long for that exact reason you mentioned. A lot of jobs, a lot of funding is tied to that cycle, right? So if you legalize marijuana, there would be a lot of judges, probation officers, bailiffs that would might lose their job due to the loss of that cycle of incarcerating people with marijuana. I don't remember I want to say it was something to the degree of 70% or more than 50% would lose their job. That was the initial study and kind of the opposition towards legalizing marijuana. Danny, what do you think about the concept of legalizing all drugs? What would that have? What would that do to local economies and governments?
So I think what we need to do is start from a place of curiosity, right? Not judgment. That obviously the things that we used to do didn't work. There's things we still do that don't work. There's things we do that do work. And I think we've got to, if we look at data and we look at Portugal, right, we need to make sure that all the controlling factors are the same or substantially similar. What would that do? Who knows? And so, if it would be something that was better for our country, for our communities, I mean, I'm all for that. I mean, we were on the front side of this thing and people thought we were crazy, and the impact has been phenomenal. I can't sit here and say today, just because I'm ignorant, unaware of what the data and the research is, that, yeah, that's a good idea or that's a bad idea. But I think we should be curious. I think we should get all the key stakeholders at the table, and we should look at this and we should see, is this a good thing or is it a bad thing? And I think the hard part is going to be, you can't just in a light switch shift one to the other, because you're still going to have the black market. I mean, the cartels aren't going to stop, trying to make lots and lots of money. You look at the gangs, the drugs, the revenue source, you look at, the guns. Like, so as we deal with this, what are some unintended consequences that end up happening? But it's absolutely worth taking a look at.
Yeah, and I think the early data was that overdose deaths dropped majorly. I mean, because you knew that the drugs were going to be not tainted. I mean, now fentanyl's taking over headlines, right?
Yeah.
Young kids, one time, all it takes is one time, one thing laced with fentanyl to end it. But you're right. Portugal is a totally different population, a lot smaller, geographically a lot different than the United States, but something that is really interesting because then crime went down, right? I mean, there's just a lot of other things that get tied to it. But I agree with you that flipping a switch could be dangerous, but I would love to see the conversation start to get started and the research start to be done to see how it would impact ourselves.
Well,
Another
I
thought.
feel
Go ahead.
real quick. I mean, you look at it, and look at, okay, the legalization of marijuana. And now, you can go to dispensaries and you can buy it. It's so much more expensive to go to the dispensary and buy it. And there's still a huge black market out there of people selling marijuana. And so those are the things that we got to look at, because somebody that's addicted to opioids is going to get their opioids, right? And if it's at an inflated price and we're taxing it and making this revenue, fine. But if they can't get it that way, they're going to get it another way. So that's what I mean by, like, there's just so many different complexities to this thing. And then there's also unintended consequences that happen from the fallout of it for the system as a whole to deal with some of the more serious stuff. So
yeah, it's one of those things where you pull over here, something moves over here, and so
yeah.
But
it's a great discussion. I'm enjoying having it.
Yeah.
The other side of it, a little bit something that might be a little bit more feasible short term, is eliminating mandatory sentencing laws for substance involved offenders. Right, you've got it now where it used to be marijuana, boom, 5 years out the door. Right now it's legalized and people are still in jail, or other drugs might have minimum sentencing. What do you guys think about changing that rule?
I guess I'll go first because I'm on the big screen right now.
Well, we'll do this then. How about that?
Yeah. So I think we do need to look at the disparate impact of minimum sentencing. And I think, especially as you look to people who are supporting their own habit and suffer from substance use disorder, jail's not going to do any good. I mean, there are times that we still have to arrest and do that. We've got some really successful stories that came out the other side, but at the end they didn't go to prison or long-term jail. But I think we have to look at this, and the first thing we need to do is, there's just a lot of disparate impact really revolve around poverty, but that substantially impacts the African American community, right? And then on the other side, you have these white collar crimes, and you have Rita Crunwell being released from the detention facility for stealing $54 million. I mean, she's done less time in the facility. I know she's, on home confinement or whatever, than some of these drug dealers we've sent away. And so there's an imbalance there. And so I think those are some of the things that we need to look at. I still, for violent criminals, drug dealers, not somebody trying to support their habit. I mean, I believe there's a place for jail at this point, right? And that's important, because when you look at communities, and I look at communities in our area that didn't take enforcement seriously and got overran by these gangs and the violence and shootings and stabbings and all these things, that stuff's for real. And there's a reason why, we were the 9th safest city in Illinois. And we haven't changed our focus from going after drug dealers and those types of offenders that are negatively impacting the community, but we've completely shifted our focus on helping those people suffering from substance use disorder. And so we reap both benefits from that, until such time the system changes. We've got to continue to take that approach. I know we talked about it earlier, but just quickly for people watching, we've adopted a 4-pillar approach. It's prevention, education, treatment, and enforcement. And for people with substance use disorder, enforcement's the last option, right? But prevention, things like the drug take back. People can come in and what they didn't use of their Oxy, their Vicodin. Prevention ties into education as well, because now doctors are more aware of prescribing practices, right? People are more aware. I know a lot of people who have significant pain, they're not going to take those painkillers because they're not going to try the education, getting into schools and really being able to connect with meaningful programs, treatment, essential, wrapping the arms around, not just the initial treatment, all the way through the recovery and beyond, right? I've got friends that are 15, 20 years sober, going to meetings 5 days a week, helping people, right? It's a lifelong choice. And then, the enforcement and the situations where you've got no choice but to enforce for people with substance use disorder. I'm not talking about, cocaine, meth dealers, heroin dealers, people lacing the stuff and that kind of thing.
Yeah, I think it's important to understand that, mandatory minimum sentences, any sentence was created as a way to stop people from committing a crime. So we're always hopeful that it drive somebody to make a decision not to get involved in criminal activity. And so you see escalating sentences to try and continue to repress crime in that way. But again, we found out that a lot of times that was broken and that system didn't work, and we had other impacts on it. So I think, again, it's a balance. Like Danny said, there are individuals that we have to get out of our communities. They do create a danger. They do create an impact. Both, that safe space continues to create these barriers, and people get concerned. They go out and buy more guns and ammunition, and so they're building a fence against this criminal activity. So I think there's still a place to get those individuals that highly impact our communities with drugs and crime, and how it relates to the gangs and those types of things. So again, it needs to be a balanced approach, and the right individuals need to be sentenced in a certain way. And I same thing. I get asked all the time when we have a high-profile financial case in Oregon. The first thing people say is this individual going to go to prison? And oftentimes my response is they probably will get probation, and they can still $40,000-$50,000 from an organization, and you put a case together, and those sentences just aren't sitting there. So again, I think we were all shocked with Rita coming back out of prison, and what message did that send? And then I look at individuals that have been users of drugs, and if you go on Judici and you take a look at what they owe the court systems, it's phenomenal. And I often use that when I talk to kids, is that if nothing else scares you away, look at how long you're going to pay Ogle County for what you're doing. So there's an economic impact that creates this cycle where, whether it's a theft or they're trying to make money to make their payments, or they miss their payments, and then next thing you know, they're serving jail time and they lose their job. And so there's this cyclical issue. So I think we have to take a look at all of that, from even the basics of using our jail system to try and keep people from committing crimes. And there has to be a balanced approach to looking at people that are on substance abuse disorder versus these individuals that are bringing crime into our community that are related to their drug distribution. So I think again, it's a great conversation to have. It's a great way to look at things and see why we're impacting certain communities and how that's affecting and making adjustments. But again, allowing our communities to get these individuals out and again create this safe space and comfort that our community members and our taxpayers deserve to have, is that safe neighborhoods. So.
And I think what you're starting to allude towards is the social determinants of health, right? Project Open started with trying to stop prevention, treatment, and recovery of substance use disorder and addiction. But what we realize is that's just one cog in the machine. We have to work as far upstream as possible to prevent and to treat. And that really boiled down to childhood traumas that oftentimes lead to use, that can lead to the unsafe environments, the absence of proper nutrition and food, that whole sense of safe physical environment, public safety, socioeconomic status. And we've really started to work in this domain now. Project Open is really starting to look at all facets of health. We know that healthcare is, our Dr. Nog, our chief medical officer at KSP, famously says that healthcare is only 10% of someone's health. The other 90% is social determinants of health. So if we want to improve someone's health, it happens outside of the four walls of a hospital. It happens on how are they sleeping well before they go to school? What are they eating? What's the home life like? Everything like that. And so we've really started to focus a lot of the projects there. But one of the upcoming big projects for the Project Open Consortium is school-based health centers, right? There are kids who don't get regular care, behavioral health assessments. There's a major unmet social and emotional need. So what do? We take care of the patient and put it right into school. And we're doing perform an ROI study on what that model could look like in the school. So I know we're approaching an hour. I know you both have very busy schedules. I just kind of wanted to see if there's any tips, strategies for other local governments you guys want to kind of hit on when it comes to the impact of addiction on local governments, and then we can call it a day. I mean, I think we could go on for another hour if we needed to, but I know you guys are quite busy individuals. So tips, strategies for local governments to get to where other areas have gotten.
I think the most important thing is to keep an open mind, to look at the conversations that are going around us, look at programs that have been successful, be open to bringing those into our communities, find innovative ways to make them work, even in small communities where we lack staffing or resources, creating partnerships. And again, working on that holistic approach and making sure that our community is aware of that. It's not just this individual that everybody's kind of talking about that's in crisis and has substance abuse issues, that there is this underlying and long-term effect that they've gone through where they've gotten where they are, and that it's cyclical. And so that we have to interject hopefully sooner than later and bring help to them. So I think the biggest thing, again, is just as communities be aware of these programs, start looking at how we can implement them, and we can increase their effectiveness throughout our area.
Yeah, I think what you mentioned there is treat the person, not the symptoms, right?
Yeah.
Yes.
Danny?
Yeah, I think individuals, organizations, and communities rise and fall with leadership. There's 4 main components of leadership: vision, culture, strategy, execution, right? And when you look at culture, that's all about how do you create great teams, healthy teams, great relationships. And so community-wise, that's community-wise, or it might be regionally. And so you really got to identify those strategic partners, find a place to align your purpose, right? Set those egos aside, territory aside, like drive what's going to impact this profit, that profit, and make it about people saving lives. Remember, 93,000 people lost their lives to drug overdose last year. That doesn't even touch the number of suicides. It doesn't touch the number of other devastating things from mental health. And behind every death, there's a family. And so it all starts with that leadership. But it's my build to Darin, to what Darin said, because all of it was just right on, is it's about synergy of the right team members. And we kind of call that synergy of champions. That teamwork is the dream work. And that makes a difference in every single thing that we do.
I couldn't agree more. I think, my closing conversation is things like this Tuesday talk. So you guys coming out and talking about it is that community education. It is creating that awareness. And it ultimately, if you don't know where to go, to start the conversation. Find one other person passionate about the issue. Start the conversation. They'll know somebody, you'll know somebody, and before you know it, you'll have a consortium of 35 plus agencies, 50 plus members working on the best ways to treat, if you can keep the patient or the individual with substance use at the center of the care, at the center of the conversation, you'll never go wrong. And with that, my name is Akil Khan, Director of Project Open. I encourage you guys to visit theprojectopen.com, our Facebook page, our YouTube page, see more Tuesday talks, and tune into a future one. Darin, Danny, much appreciated for everything you guys do for our communities, as both as law enforcement and now as city administrators and managers. And thanks for your time on Tuesday Talk. See you later.
Thank you, Akil.
Thank you,
Thank you, Darin.
Thank you, Danny.